The latest information on how coronavirus is impacting the state shows that January has been Georgia's deadliest month so far. The virus killed another 130 people on Friday. This month, we've averaged 88 new fatalities per day, compared to only 61 in August, following our summer peak. We also have more than 4,700 new cases. Now, this number is below our weekly average, but our test positivity remains high. Right now, it's close to 12%. And reminder here, the World Health Organization recommends 5% for lowering, or lower than 5% for reopening. Now, on Friday, we had more than 4,400 active patients and more than 1,500 adult ventilators are in use across the state. Now, the U.S. overall is seeing daunting numbers, reaching a new milestone in the coronavirus pandemic overnight. According to data from NBC News, the country has surpassed 26 million cases of COVID-19 since tracking began early last year. And more than 437,000 people have died. Think about that number, 437,000. The country crossed the 25 million mark a week ago on January 23rd. Arizona announced Friday that it detected the COVID-19 variant from the UK, joining 30 other states that have detected the variant B.1117. Also this week, a variant from South Africa was detected in South Carolina. And scientists are worried that 3 new, more contagious variants of the deadly virus, as concern and cases continue to climb. They're warning people not to let your guard down, even with some progress from the vaccine. These variants are a reminder for people that this pandemic is not over yet, and now is the time to really buckle down on the CDC protocols we've been following. Here's Chanu Her with more.
While the fight against COVID-19 shows encouraging signs with vaccines now rolling out, health experts are concerned about 3 new variants which originated in Brazil, the UK, and South Africa.
These are the results of normal mutations that will happen as the virus is transmitted and as it has a chance to replicate itself.
Dr. Amber Schmidtke, a public health microbiologist, says the encouraging news rooted in data shows all the vaccines help.
So far, it does seem to show that the vaccines do work against these variants. When you are immunized, you make not just one type of antibody, but several different antibodies against that spike protein.
Scientists don't believe these new variants are more deadly, but say they do appear to spread faster. The UK variant has already appeared in more than 24 states. At least 5 cases are in Georgia. Dr. Schmidtke says that's a clear sign people should be more proactive about preventing spread of the virus, because the more it moves, the more it mutates.
I understand and acknowledge that anxiety that people are feeling. The good news is the measures that we've been recommending this whole time will help us to limit transmission of these new variants, and that's what we should really be focused on right now.
We could soon see another COVID-19 vaccine in the mix in the U.S. So far, all COVID-19 vaccines that have been distributed and administered in our country are from Moderna and Pfizer. But now Johnson & Johnson is releasing new data on trials of its coronavirus vaccine. We'll have more on that coming up in the next half hour. Now, in the meantime, face masks will soon be required on public transportation. The CDC announced late Friday night that mask wearing will be required beginning Monday night. It applies to planes, trains, boats, and buses, and to transportation hubs like air terminals, subway stations, and seaports. The mandate also covers subways, taxis, ride-hail vehicles, and ferries. Operators and transportation workers will be required to wear masks as well.